Good afternoon everyone, it's Dr. McQuillan from Berkshire Menopause Clinic, and today I'm going to be talking you through how to get your cervical screening, which was traditionally called a smear test, done, and some tips to make it less uncomfortable as well. So let's begin. So firstly, what I want to show you is my equipment. I've got my trusty vulva here. I've got the speculums that are used during the procedure, and that is to help view the cervix. I have got plenty of lubricant, so water-based lubricant. So this is one of my first tips to say. There is no reason why you can't have lubricant at the time of your speculum examination and cervical screening test. It does not affect the cells, and we should be using plenty of it. The other tip I have is you can see here, lots of different sizes of speculums. Now, I always endeavour to use the smallest speculum. You can see the difference just from the standard to the small. If you have pain or discomfort, then we should really be endeavouring to try and make this as easy and comfortable as possible and using a small speculum. I start with a small speculum for everyone if I can, and the way to know if I can is doing a really good examination before you start. The reason for that is, one, you know where the cervix is, so you're not prodding around lots, trying to find it in the first place, which can be very uncomfortable. And secondly, you can assess what type of speculum you can use. And as I said, 99% of the time, I can always use a small speculum, which can be really, really helpful. The other tip you may want is that you can bring music along. You may want to bring someone's hand to hold. We can dim the lights for you because we have a light specifically that we use when we're doing the examination. And of course, if you're really worried, speak to a healthcare professional before you even have your appointment. Arm yourself with that knowledge. And I also have lots of free resources, including how you get your cervical screening test done, on my website if you want to take a look. Then we've got our bottle, and this is what goes to the lab. It takes about 4 to 6 weeks to process, and the government will write to you. You will get your letter through the post. So your GP surgery may be doing the procedure, but the actual letter comes through from NHS England. This is the brush, which is used to take the sample from. Now, a lot of people call it tickling the cervix, absolutely fine, but for a lot of people, you can really feel it and it can be a bit uncomfortable. So what I say is always take pain relief. If you're somebody who finds anything, procedures or any examinations uncomfortable, take some paracetamol and ibuprofen. Obviously check that you are able to take those and that they're not contraindicated for you. Right, so as I said, using a small speculum, getting you in position, making sure you've got some dignity and get undressed in the first place. That is what I would do. The next thing is I'm going to use lots of lubricant, and I'm going to actually examine you first, because that is how we know that we're in the correct position. So lying in the appropriate position as you would on the couch, obviously gaining consent, and then examining you with gloves. Obviously, I'm, for the demonstration of this, just using my hand on my model, but you would use gloves. So then I would do this, and I would try and find, right, where can I see this, feel the cervix? If you want to try and feel your own cervix, because I really empower women to feel their bodies, know your body inside out, and that way you know what is abnormal. Then do that. And it feels like a donut shape, the tip of your nose and a donut shape. So I know where the cervix is now. So I know which direction I'm going to be putting my speculum in, so I'm not prodding around trying to find it. And I know my cervix is near enough that I can use a nice small speculum, which can be a lot more comfortable. Then obviously explaining the procedure to someone, and then we go in, we turn it, and then we gently open it. And that is it. I can now see my cervix there. I will warn the lady that I'm about to take a sample, and you might feel some cramping. And what you want to do is you just want to go 5 to 10 times. Take it out. I haven't opened the bottle, but you would put it in the bottle. The cells go in. You'd nicely take this out. And that's it. That is your procedure done. It is not even a minute long. It is really important to prepare you so that you feel empowered with that knowledge, and that is more likely to mean that it's not going to hurt as much. The other thing is you may suffer from vaginal pain, vaginal dryness, vaginal and vulval pain, in which case you may need to be prescribed some topical estrogen. And I will do this 2 to 3 months in advance of the procedure, and that can make the world of difference between not being able to tolerate it at all to being able to absolutely be fine with the procedure. If you want some more information, if you want some support, please do contact me at the clinic, and please do take a look at the resources, and of course, please subscribe. I hope that was helpful.